Hello friends, I'm Dr. Rajinder Pal Singh. I'm back again today as promised to discuss with you another important health related topic. Please don't be scared with the topic. The subject is, can exercise cause death? Well, the most important thing is the underwriter that exercise is useful for health. And as a denominator, we know that it accrues significant health benefits in terms of reduction of cardiovascular disease, minimizes cancer rates, and reduces stress and inflammation. There is no doubting that. But equally, we cannot forget that there are some cases who have sadly not made it and have died while exercising. And we are going to discuss about that small group of people who stand at high risk, who they could be, and what can be done to minimize an adverse outcome in them. As you know, recently we had a sad case. Our respected stand-up comedian Raju Srivastavaji, he had died whilst exercising on the treadmill. During my post-graduation days in Aligarh Muslim University, one of my colleagues, her father was a doctor in New Delhi, and she sadly mentioned that he had gone for his cardiac checkup and the cardiac stress test was done and he passed away whilst exercising on the treadmill with the ECG apparatus on. That was very unfortunate. Recently in London also, we had an eminent Sikh personality who died whilst exercising on the treadmill. In transplant surgery, we occasionally get organ offers from people who have sadly passed away whilst jogging. Now, of course, the question here is that a lot of people do get health benefits from exercise, but how do we minimize these mishaps that occasionally happen? So, there was a webinar which I had the honor of hosting, and we had invited Professor Michael Henin, an eminent cardiologist from London, and this topic was discussed with him. And when we put forth such questions, Professor gave us some very valuable advice, which I think you may find useful. One of them was that he said, do exercise and run, but keep your heart rate below 120. If you raise your heart rate to up to 120, you get all the benefits. But beyond it, if you stand into the high risk category zones, then there is a possibility that more mishaps can happen to some of the people at high risk. Of course, Professor gave us some further advice that we should get our health checkups done, and if we are at high risk of heart disease with elevated lipid levels, etc., then addition of statins such as atorvastatin, these kind of medications, they reduce your chances of getting coronary disease and coronary plaques. If you have established cardiovascular disease, then they can reduce the progression, and an addition of aspirin in such cases also helps. So these were some of the benefits we got from Professor Hanin. During my childhood days, I also remember one eminent cardiologist of India, he said, please have plenty of nuts in your diet. And the most important nut, according to the professor in India, was walnuts. So in Hindi, we call it akhrot, walnuts. So please have plenty of them. I hope that this bit of information is useful to you, that do exercise, do brisk walks, and do mild joggings. If you are at a high risk, try and keep your heart rate below 120. Thank you. I hope you have liked this video. Please do not forget to subscribe to my channel, and there will be many more videos coming which I will be humbly submitting for your benefit. Thank you so much.